and from high school students what they feel about contemporary issues and burning issues that are happening around them. And I think today we have gathered here to discuss a very important topic. We've all been reading about this, right? Obviously, we all know that COVID has brought us to our knees in terms of our entire health system. If I may please request everybody to keep themselves on mute, otherwise there'll be a bit of an echo. All right, perfect. So going back to what I was saying, so like I was saying that, the COVID situation, the second wave especially brought our entire healthcare system to its knees. And especially in that we saw that, our medical professionals, the entire staff, our medical staff, everybody was stressed, everybody was anxious. They were probably working doubly, triply as hard as they were as they would normally do. There was a lack of resources. They were working round the clock. We've all started breaking cases of violence that were reported in mainstream media, where doctors were being beaten up, ward boys were being beaten up. While we understand the frustration and anxiety on side of the victims' families, we also, obviously, all of our hearts went out to the medical professionals who have been fighting this pandemic for the last them in their career, where they've been working around the clock to make things work. So I think these series of situations that have happened, this violence that has come to the forefront, has really forced all of us as a society to reflect that, why is this lack of, while we saw that, what happened during COVID, especially the second wave, was complete a failure of of the entire machinery. It was so sad to see violence was being directed to the doctors. So I want to understand from the youth, I want to understand from the students today, what did they feel, what were they studying them from, choosing a medicine as a professional choice after they graduate from school. So we're going to be unpacking this and a lot more in our conversation today. And I'm joined by two very bright panelists today. I'm joined by Mr. Ved Sen Gupta and I'm joined by Ms. Swayamshri Mohanty, both students of the South City International Bengal. Thank you so much, Swayamshri. Thank you so much, Ved, for joining us. Looking forward to hearing your views on this topic.
Thank you so much. It's really a great honor to be on a platform where students can express their views on topics such as these.
Thank you so much, Ved. That's the idea, because I think you guys will bring in a much more fresh perspective to the issue. So let's, deep dive into, this conversation. I'm sure all my viewers are waiting to hear from each of you about what you feel about this issue. Let's just come to, first initial reflections, first initial reactions to the cases of against healthcare professionals, about it in the newspaper. What was your reaction? What were your initial thoughts? Swayamshri, can we start with you?
The first I got to know about violence against healthcare professionals was around at the end of May. I was shocked by it because I thought that rather than being grateful to these people who are helping others, there are people who are attacking them, and it's seriously very crazy to think that these people who work endlessly for hours, 24/7, and number of shifts have to go through so much, and it's really unfair to them. Yeah,
I totally agree with you, Swayamshri. Would you like to add something to the initial thoughts that have been shared by Swayamshri?
Yes, absolutely. I agree with what she has to say, because our doctors, they work tirelessly, hours after hours. They go through sleepless nights to make sure that every single life can be saved, to make sure that they try their level best to give every single ounce of effort they have in order to save lives, in order to make sure that their patients can live to see another day. And then even after that, the result with some people finally attacking them and almost assaulting them in the very sad event in case some relative, that's something that's the right payback, you can say, but more like the right reward for all those efforts. So yes, I would also be shocked in a way.
Absolutely. I think a lot of us here, a lot of the social media comments one reads, the post one reads, everybody echoes a very similar sentiment that both of you shared with us today. I'd also like from you guys that you read about this violence against doctors, or generally, the way, especially I think the second wave, because which was more devastating than the first. I mean, when we saw like a complete lack of desperation in the larger population, people were running helter and skelter for oxygen resources and other important medical supplies. What did it you there? I mean, because I'm just trying to get at the root cause of that anger, and I feel that this was misdirected. Did it reflect incompetence on the part of our medical professionals, or did you feel like largely this was a systemic, we were probably not ready for a pandemic of this nature, a pandemic which would probably have so many ramifications and would engulf so many lives in one go? So let's start with you. What was your thing? How do you classify this issue in your head?
Yes, absolutely. I would say that this has quite a bit to do with our system, but I wouldn't describe failure, because a failure could be a problem which we have. And it is that our doctors are overburdened in a way with a doctor in 1:1,000 or even more in our country. It becomes very difficult to actually cater to where they where they really want to cater to the needs of every single patient. It becomes very difficult with constant influx. And it's not that this is just attributable to one particular region. I have a, it's not that I only have patients coming from this particular city. I have patients who are coming from rural areas and various different parts of the nation to this one hospital. And as a result, it's a huge pressure by the doctor's point of view and go to the point of view of the victim, of the patient themselves. They have to travel for so long to reach that medical facility. We hope that they can get the best of care where their loved one, their relative who's suffering, that person can finally live to see another day. They have to go so much of pain, so much of agony, sell their land in their efforts in order to make sure that their loved one can see another day. And then in the sad case that someone dies, then yes, I guess this is attributable to the system in a way. And I wouldn't call it the doctor's fault. I really wouldn't, because they're doing their level best, and our institutions are making sure that our doctors are trained to the maximum degree possible. So I wouldn't put it in there. I would rather call this a problem we have.
I think if we were to put it mildly, it would be that there was certain probably gaping holes. I think like us had imagined that something like this could hit us, and how nobody, you would face a shortage of oxygen cylinders. I mean, that is something that I think probably in our wildest of dreams we hadn't thought of. You've used some really important words there, which will build me into my next question about doctors being overburdened, less pressure, etc. But before I go to the next question, I would like to know from Swayamshri that what about you? What do you feel? Do you concur with what Ved does, or would you want to probably add something from your end, or you disagree with some part of it?
Failure is a very strong word to use, but in the first wave, a lot of people passed away, a lot of people suffered from COVID-19, and I think the government on its part could have done a better job in laying down a set of precautions, a set of rules when the number of cases were reduced, gymnasiums, everything around without masks. I think everybody followed precautions, then could have like avoided the second wave, or right now. That's what.
Agree. I think that's a very good point.
I don't think it's like the doctor's fault. Like the doctor doing like in that, and but like the government should have thought it out a little better. Like a number of countries were going through the second wave, and a huge population. There was a very big possibility it could have hit us, and the fact that all like people were just roaming around, it was like kind of, it was a mistake on the part of the government. Exactly. Yeah.
I you have gone through, like, a very difficult experience. Large part of the country has, but like, for example, Delhi, Bombay, Calcutta, etc. Where you have seen that there was a complete collapse of the system because of just the sheer volume of the medical attention, resources, supplies that were required. You suddenly see that now, even when things are kind of, your cases are, things are kind of going back to normal, you suddenly see that people are a little bit careful. I think maybe, and after going through such a horrific experience, I think it's important for us to reflect and not repeat those same mistakes in these interim, because you do have reports from the special task force in Maharashtra where they're saying that the third wave can be just as soon as 2 to 4 weeks away. So when you're in a situation like this, you see people who are casually going to restaurants and eating socially. So definitely I agree with you that yes, we could have better, and definitely I think there is a lot more cooperation that is required even for the people. I mean, now we have accepted in its worst. At least we are hoping that was the worst. But now at least we must take necessary precaution to avoid any future points was about a statistic that you see commonly when you read about this problem on Google India. Now, this is even before pandemic, so this is like pre-corona times. But generally, there is huge amount of frustration that exists within the professionals. So when you see it from an outsider's perspective, how do you think we can alleviate this problem? How do we get rid of this? Swamshi, let's start.
Like if you see in any professional field, there is going to be a certain amount of stress in everybody. Like everybody goes through stress, but doctors especially have to go through it a lot because they're on call like 24/7. Whenever they have a patient, any emergency happens, they have to go to the hospital and do their work. I think a way we can avoid this is by encouraging more people to become medical professionals and like start recruiting more doctors, more nurses, which can help reduce stress for other doctors, and like it can also improve like the efficiency of the healthcare industry, because as there are more doctors will be able to aid to patients. And similarly and like at the same time, doctors will also be a little less stressed and will have the next patients like mentally prepare themselves. And yeah,
With you, we definitely need, I think the biggest problem that we face in the medical profession today is the fact that we have, we are not churning out as many doctors as we should. We don't have enough people who are willing to get into this field, and this is going to come back again. This is another question I will take about how motivated are people from your generation feeling about taking medicine as a profession choice. But before I go to that, I think one of the biggest questions that I like you guys to answer is about the spread of misinformation. I think this is something that has been a huge problem that we have faced during COVID, thanks to WhatsApp University and everybody who seems to have mastered of research, you see so many forwards that are being, shared over WhatsApp, and we have seen that how they have triggered in negatively in people, fueled emotions, because you need to understand that if you're lucky enough, nothing's going wrong in your house, you send something is going wrong, like, they have people who are suffering from this disease, it can cause a lot of panic. And sometimes start think that, that has like added fuel to this problem. And how do we resolve this issue in India? I mean, you guys are the young generation, there's so much of information you guys get access to over social media, all kinds of forwards, all kinds of these difficult situations which are triggering such violent emotions.
Yes, I believe that we actually find a way around this problem by increasing transparency, but not only directly from the government. We can't just ask the government, okay, now churn out more information regarding COVID, or make even more social media posts regarding certain basic healthcare procedures which we can follow. What can actually be done, even from a student's end, is NGOs who have experience in the field, who know the facts, who know what's not followed during an emergency. And what we can actually do from our end is, perhaps if I step aside from COVID scenario, let's hope for the best that we are able to overcome it. But still, what's the way? What we can actually do is, as students, we can go to NGOs and we can gather the information, disseminate that as students. Because yes, just relying on WhatsApp messages for information, that's not enough. Just suddenly Googling a certain case's symptom, that's not enough. Proper information. And from a student's perspective, this is the minimum we can do. We have to make sure true information from the government, from your medical professionals, from...
Correct. I think I totally agree with you there. And a fantastic idea. One is obviously the fact that the best way to counter misinformation is to put out more information, to put out more verified and authorized information coming from very credible sources. The other thing on the government, they already have a lot on their plate. So why don't we get like education institutions, universities, schools, etc., can also start chipping in to make sure that the correct information is going to be spread. And I think it's very important that we reach out to the student network, because I think like in India, you have like in the house, it's very likely that you have one or the other who's a student, and if the older generation is getting access to certain dodgy information, they can at least put forward like very valid and credible information before them, which can avoid this spread of because I think this is a problem that we have all faced and on a daily basis. How do you think we resolve this, especially in the backdrop of this scenario, because actually trigger violence against medical professions? So how do we resolve this in this scenario, considering we're in a pandemic still?
Yeah, I feel like misinformation is very problematic. Like at the start of the COVID-19, like in 2020, my mom, like the mom WhatsApp groups, somebody posted like haldi, what is going to protect you from coronavirus, and I'm like, it's not gonna. No, that's not true. And I think, and there are people who are gonna believe that. My mom was like, what? This is not true. And like, I think as institutions, schools should do their part in spreading the right information, authorized, verified information. And people should not believe everything that they see on the internet, because like articles, like, not necessarily 100% true, especially article written by a random person. Like anybody can write an article on the internet, and somebody might read it and think of it as true. Then the person will be like, oh no, the doctor is doing the wrong thing, this is not right. And then that leads to violence. Like Exactly. I think professionals should be the one who are spreading the information rather than random people like on the internet. And people should also not believe everything that they see on the internet, and do research before making any judgment.
So I think good points coming there, that we need to have increased professional intervention in terms of spreading of information. And second and most important, we have access to so much information. We have access to Google. I think it's important for us to do our due diligence before we act on anything. And I totally agree with you. This haldi water decoction, I mean, we've all we've also fallen prey to it. And then suddenly you realize that no, somebody will say that no, this is not good. It's important that we just pick up our phones, just speak to our physicians or doctors and just verify from a professional that whether this is something. So due diligence is very much key here. Now, come to, even like a pre-COVID situation, I think generally in India, it's very unfortunate that